If you're new to this podcast, my name is RuthAnn. My husband Lance was a service connected, disabled U.S. Navy veteran. He was sick for 25 of the 27 years we were together, and the last 12 years of his life, I was his full time caregiver. I often wondered if the people treating Lance, doctors, residents, usually the residents, sometimes the physician's assistants, realized that he was a human being and not a science experiment. That whatever they did to him or whatever they prescribed, he was going to have to live with when he walked out of that office, that we were going to have to live with it. Did they realize it? Did they even care?
I've been very fortunate in my own life to have been, I would say, extraordinarily healthy. When I look at many people that I'm around and, I hear that maybe they've gone through one thing or another, different um, struggles with their health. I don't have a lot to relate to because I have been so blessed with good health, and so have my kids. So I've really limited experience with this. But all that to say, I do watch other people and I see what they go through. And this has crossed my mind on many occasions. I know someone who's gone through a lot of health struggles with her son, and he they were just these like vague symptoms that they didn't necessarily lead to anything very obvious. So there were a lot of tests and a lot of specialists and a lot of back and forth and searching. And I just remember thinking at one point, is he just a guinea pig that they're running all these tests on to try and um, like see what they can find? Or are they actually looking for an answer? Are they really looking for a solution? Or are they just using him as a test subject? Like, I genuinely thought that. And so I think this is a really important conversation because these are not fun things to say out loud, to question the intentions of somebody who has sworn their life to trying to make trying to help people get better. So it's kind of a tough thing to say. So I'm glad that we're saying it, even though it is maybe a little uncomfortable.
Well, we encountered many people who didn't have the best intentions. And I'll talk about some of those things throughout these episodes. Today, I've got a couple of things that I want to talk about, but Lance, from the early days, he used to go to all of his appointments himself because he was sick for over 25 years while we were married. And in the beginning, we were both working after he got out of the Navy. So he would go to the doctor appointments by himself unless he needed a driver, if he had some kind of a test and he needed sedation or whatever, or if we were getting the results. Otherwise, he would go by himself. And he would come home from those appointments and he would be so upset and he would say, I'm not even sure that they realize that I'm a human being. Sometimes I feel like a guinea pig. Well, we don't know. Why don't we try this? And because he had such a rare blood cancer, there wasn't really anything to treat it. There had been very few studies on it at the time. And he just always asked me, do you think anybody even cares about this? Because I don't even feel like I'm a human being. And that only got worse as his disease progressed, as his cancer progressed. One time we were sitting in the emergency room. He had countless visits to the ER. I don't even remember. I stopped counting at 50, and that was several years before he passed away. So most of the time he got admitted into the hospital when we went to the ER. So this time we knew that he was going to get admitted. We were just waiting for them to get all of their stuff together to figure out what they were going to do. And the group of residents was all standing outside of his little area where he was in the emergency room, and we could hear everything that they were saying. And they were looking over some lab results, and they were trying to determine if there was something really rare going on with his blood. And they were all so excited about it because it was something that they had read about, but it was something that none of them had ever seen yet because they're just young. And someone from the team came up to them and said, "Oh, it's not that." And you could just visibly see all of their bodies just kind of go, "Oh." And they said it out loud, "Oh, darn it. We were looking forward to studying this." And one of them looked at me and must have seen the look on my face and said, "We're glad for you that you don't have it. But, for us, this is why we went to school." And I thought at the time, this is a human being. And it wasn't just Lance. I was affected by this just as much as he was. I was the one that had to take care of him. So Lance and I were the ones that lived with this all the time. As soon as we left, we were carrying whatever it was with us. They got to go on about their lives and do whatever it was that they were doing and not ever think about it again. And that was one of the things that bothered me so much about him being in a teaching hospital was the bedside manner of the residents. These are human beings that you're dealing with. They're not science experiments. They're not guinea pigs. These are people, human beings. Can we please treat them like they are human beings?
I can't even imagine having to go through that. It's like I said, I'm so incredibly blessed, and it is not lost on me how fortunate I am to have had the health that I've had, and my husband and my kids. Like, we've been so fortunate. And I hear these stories, and like I said, I've just watched from the sidelines different people deal with these similar scenarios. And it seems to me, and maybe you can speak to this, a good doctor that is very patient centered and whose intent is to, as quickly as possible, find the best solution for that individual patient to make their life as good as it can be and bring as much healing to them as possible. Like, that kind of doctor seems like they would be worth their weight in gold. Not somebody who is dismissive, not somebody who is using you as a science experiment, not somebody who is just trying to get you out of their office and get on to the next person. And this isn't, for me, not a criticism of doctors. It's just a realization that if you are going to commit your life to helping others, that would seem to me that that needs to continue to be your focus, is actually helping, not trying to, conduct experiments.
Well, and this was more to do with the residents. That was most often where the problem was. And like I said, those are young doctors. They're in their 20s. And often, some of them are older, but they haven't had the life experience. But I don't think that that's an excuse. I think that if that's the case, if that's what is happening to patients because residents don't have the experience, then they should be trained better on how to deal with human beings. Because Lance had such a rare disease. And I think every single resident that ever saw him, and he saw dozens of them over the years, every single one of them said, "I've heard of this. I didn't think that I would ever see this," or "I've heard of it. I've never seen it before." So Lance was always one of the patients that they wanted to see because he had so many things wrong with him and he had such a rare disease that it always turned into It was almost like a little show. Like it was let's run this test and this test and this test. I felt like they overkilled it on the test because this new resident had never seen this and they wanted to see it for themselves. I mean, it really did feel like Lance was a science experiment all the years that he was sick and disabled in the hospital. And those were things that we had to live with when we left there. And thankfully, he had short-term memory loss and he had dementia, and that's an awful thing to say. Thankfully he had that, but that was what I always thought of when I took him home, was he those memories might be there somewhere, but it's not something that he's going to carry with him constantly. And so I was always thankful for that, but I carried it with me constantly. It is still with me today. All of the traumatic experiences that we had, because Lance was not treated like a human being, he was treated like a science experiment. And I can understand the fascination. I was fascinated by his brain. I was fascinated by the things that were happening to him, and that he got up every day with a smile on his face, and he loved people and he loved life and he wanted to live. That fascinated me, that he could have that many things wrong with him and still want to get out there and live. But I also recognized that he was a human being. And that's what life is about. It wasn't about him being there to serve somebody else's curiosity, which is what it felt like for so many years. And I just dreaded all of our trips to the hospital because I knew that the possibility of that happening again was very high because it happens so often.
I have a question on the other side of this. So, for those who might be dealing with something that's very common, like it's a very common illness or a very common disease, in the instances where he did have something that was more common, um, did you find that people were more dismissive because it wasn't interesting and they just threw kind of blanket treatments at it, like, oh, this usually works, we'll do this, and didn't take it seriously? Or again, see him as an individual and as a human being who you may see this every single day, but not every single person is going to react the exact same way to the treatments or the medication. So I wonder if on the flip side of that, if you have something common, if you were dismissed because you're not interesting.
Yeah, we definitely saw that. He had central hypothyroidism, and he saw the endocrinologist for, I don't know, maybe a year or two. And this was in the early days of his disability. So he was still managing most of his medical stuff on his own. I wasn't really aware of a lot of these things. I was going to the appointments with him, but I was allowing him to make all of the decisions on his own because his mind was still intact. And after a couple of years, they just had everything managed either by his primary care doctor or he saw a physician's assistant. And I knew that there was something going on with his thyroid. It was probably about 10 years after his hypothyroidism diagnosis. And they wouldn't let me in to see the endocrinologist, and they wouldn't let Lance in. I was the one that made the appointments, but they wouldn't let him go in to see the endocrinologist because they figured it could just be handled by the physician's assistant. And it turned out that he was being treated for the wrong type of hypothyroidism, and he was only on half of the recommended dose that he should have been on. And that was creating a number of the symptoms that affected his quality of life. His life could have been so much better for 10 years because they figured it was something that was not a big deal and they wouldn't allow him to see the endocrinologist. So yes, that definitely happens.
What would be your advice to someone who's going through this? Or I hate to even ask this question because I don't know that it's really productive, but if you could go back and tell RuthAnn then, like, here's how you can handle this that might provide a better result. Like, is there something, I don't want to say that you would have done differently, but what have you learned through it that you would like to share with others who might be in the same situation?
I think the main thing that I've learned is that there's a view of what a caregiver should be, and that is of a meek, submissive person. And so when I tried advocating for Lance, I was shut down a lot. And I, in the later years, I advocated very fiercely for him. And I got him the things that he needed finally. And I think that if I had it to do all over again, from the early days, I wouldn't let it bother me that somebody called me a bitch, or that somebody stood up to me because they didn't like the fact that I questioned them. Because I knew my husband. I knew that there were things wrong with him. I knew that he needed things, even if there were people saying that he didn't. And so I would say to anybody, trust your gut. If you feel like something is not right, if you're unhappy with the way that your loved one is being treated, then stand up and say something. And if you don't get anywhere with that person, then go to their boss and go to their boss and keep going, because they're human beings and they matter. It's not just about science. It's about people.
Exactly. Um, I think that's good advice for probably anybody, to trust your gut. You know what's best for you. You know what's best for the people that you are caring for. You know what's best for um, anybody for whom you have the opportunity to advocate. Trust your gut, and don't let your own self-doubt get in the way of what's best for the people you love the most.
Well, not only that, but don't let people gaslight you into thinking that it is you, because I had that happen to me a lot. Well, I think that's enough for today. I've got lots of stories, so I'll be sharing stories until I run out. Thanks for joining me, Jenna. I'll see you next time.
All right. Thank you. Bye.